Here was the milestone moment yesterday as two residents of a Whitehorse care facility received the first shots in the territory yesterday afternoon. The plan this week is to continue vaccinating long-term care residents and staff and the elderly. But we're going to get lots of detail in terms of the plan and the logistics to come in the territory from our next guest. Dr. Brendan Hanley is the Chief Medical Officer of Health for Yukon, and he's in Whitehorse with us this morning. Dr. Hanley, welcome to our program and Happy New Year.
Thank you. Same to you. And good morning.
Let's look at that shot again, if we can, that moment of the first shots in the territory. How did the first day go?
It went really well. So we had 60 residents and staff immunized for that first day. All went smoothly. There's, as you see, a lot of smiling faces. Really a kind of a feeling of relief. And this is only the beginning. So it's a really exciting day yesterday.
We'll look beyond the beginning to come, but when you say the smiling faces, and likely yours too, you as much as anyone locked in this tough fight with coronavirus. So on the emotional level, how did it feel for you yesterday?
Well, it's definitely another one of those major, pivotal moments in not only in the pandemic, but I think in our Yukon history. So really, this is a time with the new year of new optimism, new energy. There's a lot of work ahead of us, of course, but this really brings a whole new element into the fight against this pandemic.
What is the degree of enthusiasm for getting the vaccine in the territory, do you think?
Well, I know that there's a lot of people waiting and enthusiastic for wondering when their turn is. I think with that there's a tremendous community here. The community has been so together right through this pandemic, and I think that's one of the reasons that we're doing so well. So I think I sense the same kind of positive energy, anticipation around the coming of vaccine.
People in Yukon have obviously had to wait longer than in other parts of the country to get the Moderna vaccine, which is easier to transport. The logistics in the territory, as I understand it, Dr. Hanley, you'll have 2 mobile teams and 1 based in the convention center. Can you tell me what Yukon's rollout plan looks like?
Yeah, so the focus, as you were saying, the focus for the first couple of weeks is on our long-term care residents and staff. And so that started yesterday, and that's continuing through this week and into next. And meanwhile, we're starting to prepare and mobilize the team. So what we have is the Whitehorse Convention Center is our mass clinic site. And that we already practiced that with the influenza vaccine in the fall. So so that's getting ready to go, and that can process up to 1,000 people a day through the Whitehorse Clinic, starting with our high risk priority population. So that's going to happen within the next couple of weeks. And at the same time, mobilizing these 2 teams that are going to go around the all 14 Yukon rural communities and have vaccine ready in the communities. That might be, in some cases, a few hours, in the larger communities, a few days, but all of that will be mapped out to cover the communities in a 2-week period for the first dose, and then back again a month later, or in that range for the second dose.
Yes, it's 28 days for the Moderna vaccine, and that was going to be my question. It's interesting. There's been quite a discussion, not just within Canada but even internationally, whether the aim should be maybe to get all of the doses out into as many arms as possible and then hope that the supply's there. But then the original protocol is the 2 doses, in this case, 28 days apart. It sounds to me that you're sticking to the original plan, the first dose now, and then the other. You have 7,200 doses in this initial shipment, so 3,600 now, and then the rest later, the second dose?
We will be just using our doses and counting on the next supplies in a way, it's risk managing. So we will be continuing to not hold back our doses, but using the subsequent shipments of doses as they come in to cover our second doses. And we know that there is going to be likely some flexibility around that 28-day period. I mean, as you say, that very much is a national discussion. We're certainly talking with other jurisdictions and internationally about about what the best approach is. But really, our efforts are really concentrating on getting as many people covered with that first dose. And I think we're going to be able to get our second dose in a very comfortable period. It may not be exactly 28 days, but we realize that there is likely going to be some flexibility around that second dose timing.
So that is interesting. I misinterpreted based on what you were saying. I thought you were holding back, but you are deciding to go ahead, even though that's not what the original Stage 3 clinical study indicated. You're taking, as you said, looking at risk management of the factors and putting as many of the doses out there as you can right now. Do you have any particular, as a medical professional, do you have concerns about having to choose that strategy?
Well, again, I think that based on our allotments coming in, we're going to be okay. I'm certainly comfortable with that margin. We've had a lot of experts weighing into that discussion about does it have to be exactly that 28-day second dose? Really, what the literature and the experts are telling us, and we have a long history of course, of immunizing and knowing that it's that the second dose definitely will be important, but the exact timing probably less important. We will be covering everyone with the second dose. But allowing a little bit of flexibility around that 28 days will allow us to get everyone covered in a timely way. And of course, we are going for a population level approach. We are aiming to get 75% of the population at least covered really by springtime. So really within the next 3 to 4 months. It's
an ambitious schedule. And because you've had to wait, maybe you've seen the other regions of the country deal with some of the snarls that have slowed up in some ways the rollout elsewhere, learn from that potentially. We'll keep in touch to see how it continues to go in Yukon. Thank you very much, Dr. Hanley, for your time this morning.
My pleasure. Thank you.